Hello and welcome to Arirang TV's continuing special coverage of COVID-19. I'm Min Son-hee. In today's studio session, I have the head of the country's health insurance review agency to share with us the role of the country's health insurance service to better respond to the global pandemic. But first, here as always, are the headlines with our Kwon So-ah and Noora. Welcome.
Hi.
So let's begin with you. I understand the government's daily meeting on COVID-19 has marked its 100th session.
Yes, this Friday was the 100th time the Central Disaster and Safety Countermeasures Headquarters held its regular meeting on the responses against COVID-19. Presided over by Prime Minister Chung Se-kyun, this meeting is attended by around 3,000 people, most of them, of course, joining virtually. And it involves the 17 regional governments and ministries, from the Health Ministry to the Foreign Ministry, Education, Culture, and Economy-related ministries, who all share information transparently for swift decision-making before all of that is provided to the nation's people. The government assessed today that this pan-governmental system has played a big role in dealing with the coronavirus crisis in the first half of the year, and also believes the experience will also become an asset for the post-pandemic era. One of the information gathered and analyzed at those meetings are, of course, the daily updates of COVID-19 cases. So let's take a look at Friday's figures. We have 39 new cases. That's the same number we had the day before. The death toll stands at 273, so unchanged from Thursday. And we have 32 additional people quarantined and 7 people who fully recovered from the COVID-19 virus. And daily figures have been seeing less fluctuations in the most recent days. They are now between the 30s and 40s.
Right, so I understand it's also been about a month since we shifted to the daily life or everyday quarantine guidelines.
Right, and that's also been stressed at the 100th government meeting earlier in the day. And that shift happened on May 6th after the Golden Holiday, as the country saw numbers decline to single digits, and the government evaluated that containment measures could go hand in hand with people's daily lives. Public and multi-use facilities began to reopen under new social distancing guidelines. But there have been a number of outbreaks after that shift, which experts say was unavoidable. Community infections started to outnumber imported cases, especially with the most densely populated metropolitan area affected. And in order to prevent a second wave and not roll back to strict social distancing again, authorities renewed their call today for people in the Greater Seoul area to postpone gatherings this weekend, including religious events, which became the source of recent hikes in COVID-19 cases. So before we do head into the weekend, let's check the day-to-day hygiene and quarantine guidelines, which you're seeing here. Stay home for 3 to 4 days if you feel sick, and stay 2 arms length away from others. Wash your hands thoroughly and cuff in sleeves. Also make sure to ventilate and disinfect regularly, and stay psychologically close to family and friends while abiding by physical distance.
Right, so let's take a look at Latin America today, where one of the most serious situations I hear is unfolding.
Right, record after record is being broken every day. The World Health Organization said this week, in fact, that Latin America has become the red zone of coronavirus contractions. On Thursday local time, Brazil, the hotspot in the region, has become the country with the world's 3rd highest COVID-19 death toll, with more than 1,470 fatalities reported on that day. It just recently overtook France. Now it has more cases, death cases, than Italy. The country's president, following the release of latest figures, continued to attack social distancing measures, though, claiming the country will suffer more from the economic fallout. Chile, which recently exceeded the 100,000 mark in total infections, saw its largest single-day hike in deaths on Thursday, with over 80. And Mexico reported a record death toll with more than 1,000 deaths for the first time in a single day. And now let's move over to the world figures. The U.S. has over 1.9 million infections, with its death toll surpassing 110,000. And Brazil's total caseload stands at over over 615,000. Spain and the UK have similar cases of more than 280,000. Moving over to other regions, India's figures are ticking up now at around 226,000, and Peru now is close to Germany when it comes to accumulated cases. And a quick look at our world map. In total, there are now roughly 6.7 million cases and 393,212 deaths were reported, and some 3.25 million people have now been cured from the coronavirus.
All right, so thank you for that, but do stay with us for more of the domestic updates after the regular briefing.
All right.
Aram, the weather is getting warmer and there is more demand, I hear, for breathable masks.
That's right, and to meet those demands, manufacturers have started online sales of thinner and breathable masks starting today, in fact, and they are priced at a cheaper price as well, 501 each, which roughly accounts to 40 US cents. They are much thinner, as I said, than conventional masks and are usually used by surgeons, so the light blue that we see a lot of surgeons and dentists wearing. However, due to a surge in the popularity from today, an online shopping mall actually crashed to a server overload, but that problem has been overcome since. And the high demand before today actually led to a price surge in thinner masks and an exhaustion of supply. Hence, the government is taking action to control those prices and stabilise the supply. That's why the government approved 9 products made by 4 companies to be released online. And one of the firms, which prepared 200,000 masks on its first day of sales, said it plans to continue to provide 100,000 to 200,000 masks on weekdays and consider expanding sales outside of its website so they could be available offline as well.
Well, that is good to hear. Now, I also understand the UK hosted a global summit on vaccine development. Tell us more.
That's right. The race for a vaccine continues, and the Global Vaccine Summit on Thursday brought together leaders from governments, civil society and the private sector from around the world. And the summit actually managed to surpass its target of raising funds of $7.4 billion to $8.8 billion. So that was a good achievement there. The money will help support a global vaccine alliance led by Bill and Melinda Gates called Gavi. Now, Gavi has operated for more than 20 years and develops and distributes vaccines in poor countries. And the funds raised from the summit will help 300 million children get vaccines, as well as assist poorer nations to strengthen their medical and vaccine distribution systems. Now, closing the summit, UK Prime Minister Boris Johnson called for international cooperation in the fight against infectious diseases, not just COVID-19. And he also stressed the need for a global alert system to rapidly identify any future outbreaks.
I see. And over in Romania, a magazine has released a detailed piece on Korea's policies, I hear.
That's right. The diplomatic magazine Geopolitica outlined what measures Korea took to fight the virus in its summer edition. Now, the piece was actually a breakdown of a 100-page analysis of Korea's measures that was released last month. It reveals how Korea managed to respond to the economic fallout from the virus, as well as carry out online classes for schools, hold the general election back in April, and also open its baseball league, one of the first countries to actually start one of its sporting leagues. Among other issues were delved in as well. Now, the article was written in English and therefore is likely to have a wider audience, further promoting Korea's standing as a global benchmark in virus response.
All right, Aram, thank you for that. Take care. We'll see you again on Monday.
You too. Thank you.
Now, it's a little after 2 in the afternoon here in Korea, and we await the regular afternoon briefing on the COVID-19 situation here in this part of the world. Phase 4 of the resumption of offline classes is slated for next week. In this final phase, 7th graders in middle school and 5th and 6th graders in primary school are poised to return to classrooms nationwide. Within the precautionary measures are reduced class time as well as the total student number at any given time and a blend of offline and online sessions. Masks are mandatory on school grounds, and speaking of face masks, as our Noara mentioned, those that are lighter and less tight-fitting are on sale starting today. They cost around 500 won, roughly less than half a dollar, and for now you can buy them online, but hopefully they'll soon be available offline as well. Health officials are advising, however, that those masks work like surgical masks and are recommended for healthy individuals in largely non-risky settings. Because these masks are breathable, so to speak, they're more comfortable to wear, but they do not filter out all airborne particles. Accordingly, those who are more vulnerable to infections are being advised to wear the KF80 or KF94 face masks. Here now is the briefing. We'll come back to you afterwards. Oh, I see the briefing has yet to start then. What we could do right now is perhaps take a look at the numbers for this Friday. Here in Korea, as our Soa mentioned, our confirmed cases stand at 39 on this Friday, raising our total number of infections to 11,668. We have the briefing now. We'll come back to you after it.
Let us now begin our regular briefing for the COVID-19 response. As of June 5th, Friday, we have 39 new cases so far, and the total number of confirmed cases now stands at 11,668. Of them, 87.2% are South Korean nationals, and 7 more people have fully recovered. And a total of 889 people are in quarantine undergoing treatment. Yesterday, we had no additional fatality. And let us now look at the domestic infections. Out of the 39 infections yesterday, we had 34 local transmissions. And in relation to the imported cases, we had 5 imported cases yesterday. 3 were from America, 1 from Europe, and 1 from the Philippines. And here are some updates on the major domestic infections. In the Kupang Logistics Center cluster in Bucheon City, Gyeonggi-do Province, compared to yesterday, we had 4 additional cases, and the total now stands at 124 accumulated cases in relation to this. And in relation to the newly planted churches in the metropolitan area, we have 10 more cases, and a total of 76 have been confirmed to date. And in Gwanak-gu district in Seoul, at the Rich Way, we had 9 more cases, and now the total stands at 29. So the quarantine authorities, we are currently looking into all of the workers and visitors who have visited the Rich Way in Gwanak-gu district in the Seoul during the 22nd of May to June 1st to get tested as soon as possible at these screening clinics regardless of your symptoms. And we have additional outbreak, and there is a family in Seochogu district in Seoul City, and we have identified that one person who has been working at the AXA General Insurance call center in Jongno-gu, Seoul. We have 1 additional case of that case. And in relation to 1 case at the church, in a local church in Incheon, we have 5 new cases. And at Daeseogu of Daegu, we have seen symptoms by the middle school student who has shown symptoms of fever and other respiratory symptoms. And this person has been confirmed of the virus, and we are conducting epidemiological investigations. And in Gyeongbuk, Gyeongsan, we have been doing testing of all of the people who at the dormitories there. And one of the Meister high schools there has been confirmed. 1 person has been confirmed from this high school. So the high school has been switched to online classes. And let us now look at the data on chains of transmission for the infection during the last 2 weeks. Cluster infections account to a majority, 73.2%, and 9.4% of them are under investigation currently. And of the local transmissions, about 96.6% or 74% which are under investigation were clustered in the Seoul metropolitan region. And in the metropolitan area where we see a dense, high population density and foot traffic, we are seeing increased infections in the community level, and we believe that we have great concerns of a possible widespread cluster infection. As for the fatality rate, the COVID-19 fatality rate here at Korea stands at 2.34%, and if you look at those over the age of 60, it is above 13%. And this fatality rate increases even to about 20.4% as for the senior citizens over the age of 80. So we are alerting all of the senior citizens above the age of 65 to be special alert. And during the weekend, we ask all of the religious facilities as well as all residents in the metropolitan area to avoid going to crowded, confined, and close contact environment spaces. And in religious facilities, we advise you to avoid dining together and engaging in large gatherings and engaging in activities that involve high droplet producing. And we also ask you to switch to non-face-to-face meetings. And if you have to have an on-site service, please reduce the number of participants to ensure that participants can maintain proper distance, check people for fever and other symptoms, ensure hand washing, and require mask wearing. And next are some updates on the progress of our R&D efforts. South Korea, up until now, we have been cooperating with the international community to develop COVID-19 vaccines, and we are currently having the first phase of clinic trials and the second phase of the clinic trials of a drug that has been developed by a U.S. firm. And these are in planning right now, and this is being supervised by the International Vaccine Agency, and it will be carried out under the supervision of the SNU hospital here in Korea. And we are also planning to develop and continue the laboratory clinic trials. And in our roadmap for the R&D for the COVID-19 therapeutics and vaccines, we have heard of the 36 companies, and we have heard their opinions, and many of them have said about the biosafety measures, so-called BLC, and we also have announced new measures for these, and they are uploaded on the homepage, and we are now awaiting the applications by the industry and the laboratories. And as for the plasma therapy that we are developing, we ask more people who have fully recovered to donate your blood for our R&D purposes, and a total of 26 people have donated their blood, and we ask for more participation on this end, and we thank all of those who have already donated their blood. And more recommendations for the public. We have also announced this throughout our press kit, but we are continuing to witness cluster infections in the metropolitan area, which has started from clubs, the logistics center, and other small group religious group gatherings. And remember that in the metropolitan area, at the crowded and confined and closed contact environment, anyone can be exposed to the COVID-19 virus. And the quarantine authorities, we are currently exerting our full efforts to curb further outbreak here in the metropolitan area. I know that this is a very difficult time right now, but we would like to thank once again for all of the participation by the public for your response. And we are continuing to see cluster infections, and we believe that it is not easy to stabilize the live quarantine measures, and this is only possible if we have the social support and social participation. And even at this moment right now, we are in the emergency state of quarantine. However, going beyond the quarantine realm, we need to believe that we need to see this as a positive trend, and we also need to note the appreciation of the medical staff and all of the pan-government efforts centering around the efforts put forth by the Prime Minister, and all of these cooperation were able to let us enjoy today's presence. And the government is also fully devoted to develop our vaccines and therapeutics, and as well as our other R&D efforts. And despite difficulties, I would like to thank all of the public for your continued support. And please remember that the quarantine authorities, we are also continuing to work around the clock. Thank you very much.
Right, that was Kwon Junuk, the Vice Head of KCDC, with Friday's afternoon briefing. So do give us a summary of the key announcements.
All right, we have 34 new local transmissions out of the total 39 cases that were reported today. The rest of them were cases imported from the Americas, Europe, and the Philippines. And it looks like, according to the government's assessment over the past 2 weeks, some 73% of these cases were cluster infections, while some 96.6% occurred in the metropolitan area. So let's take a closer look at some updates of the recent sporadic infections. First off, the case in Bucheon related to a distribution center. 4 more cases were added to that case, bringing the total to 124. And then a case linked to small churches. 10 more were added there, bringing the total to 76. And there were numerous other smaller infections at companies in the capital Seoul. Just to name one of them, Richway has 19 more cases, bringing the total to 29. And still, contact tracing will be conducted over the weekend, which is why the Vice Chief echoed other officials' earlier remarks that people in the metropolitan area should try to refrain from gathering, and especially in confined spaces, and also try to abide by the social distancing measures, including not to go to offline church gatherings.
All right, so thank you for that. We'll see you again on Monday.
Thank you.
Back on the international front, COVID-19 is not the only health crisis that authorities in the Democratic Republic of Congo are fighting. They've confirmed a second Ebola outbreak amid also the world's largest measles outbreak. I have the Korean ambassador Kim Gi-ju to Congo live on the line with more details. Hello, Ambassador Kim.
Hello.
Ambassador,
very nice to talk to you.
Thank you very much. It's nice to talk to you too. Ambassador Kim, please tell us more about the latest outbreak of Ebola in Congo.
Yes, Ebola virus disease has affected the eastern part of the Democratic Republic of Congo, which is also called the DR Congo, since August 2018. The virus has already claimed more than 2,200 lives. On top of the ongoing cases in eastern part of the country, there is a new outbreak of Ebola virus disease in Headquaters province in northwestern DR Congo. It was announced Monday this week. 8 people are infected, and 4 out of them died, unfortunately. The alert of public health emergency of international concern declared by the WHO July last year is still in place.
And of course, Ambassador, adding on to the burden of medical workers, that is the COVID-19 situation. Ambassador, what is the situation of this pandemic like in Congo?
Yes, the spread of COVID-19 infections in the DR Congo is growing too. More than 3,600 people have been infected. 78 people lost their lives. Geographically, the virus is spreading to 10 provinces out of 25. The Congolese government has imposed a state of emergency since late March. The borders remain closed, international flights are suspended, and the downtown area of capital Kinshasa is under lockdown. As you rightly pointed out, what concerns the international community is that COVID-19 disease poses additional challenge to this country, which has been suffering other infectious diseases, including malaria, measles, and Ebola virus disease.
Ambassador, I believe we have Korean nationals living in Congo. How are they faring?
Yes, there are up to 120 Korean nationals living in this country. There is no report of infections affecting Korean community members residing in the DR Congo. The priority of the Korean embassy is to ensure health and safety of the Korean nationals residing in this country. What the Korean embassy is doing, most importantly, is to engage closely with the Korean community. First, we share on a daily basis updates on the infections with SNS. Second, the Korean embassy conducted visits to Korean companies and households and distributed personal hygiene items, including facial masks and hand sanitizers. Last but not least, the Korean embassy has also assisted 24 Korean nationals in their safe return to Korea since the suspension of international flights.
Right, that is good to know. Ambassador, many African countries have vulnerable healthcare systems. How is the Korean government working with its African counterparts to better deal with such health challenges?
Yes, the Korean government is closely coordinating with the Congolese counterpart to cooperate in our collective response to COVID-19 disease. We are doing this in various bilateral and multilateral channels and platforms. Bilaterally, we are in close cooperation with the Congolese government, provided with Korean manufactured materials and equipment, including test kits and walk-through test booth equivalent to $300,000+. We provided the UN Office for Coordination of Humanitarian Assistance with $500,000 of fund. A project is underway with the UNDP and COICA to help establish the second test facility in this country by utilizing resources and financial assets of another $500,000. It is encouraging that private sectors are engaged in the activities too. A Korean hospital will contribute their specialized expertise to the joint project with the UNDP. A Korean NGO named Good People is also reaching out to the Congolese people. They provided $20,000 of resources. Last but not least, a Congolese pharmaceutical firm, together with a private hospital in this country, procured 15,000 units of Korean-made test kits, which would substantially contribute to their test capacities. So all in all, I would say that we share a strong sense of solidarity and make our resources and expertise available to the needs of the Congolese government and people as much as we can.
Right, Ambassador, that is good to know. All right, Ambassador Kim, thank you very much for joining us live at the SAR.
Thank you very much indeed.
One of the big concerns facing patients battling COVID-19 is huge medical bills. In the US, costs for COVID-19 treatment could reach $20,000 per person. They are about the same in South Korea, but the difference lies in the actual costs borne by patients. In South Korea, testing is free for those experiencing symptoms or those who have made contact with an infected person, regardless of their nationality. Treatment is also free for those who test positive. This allowed people to get tested quickly, which led to early detection of infections. South Korea's effective response to COVID-19 has brought renewed attention to the country's healthcare system.
I think that the fact that the Korean healthcare system is universal and it's really well funded through this public and private insurance model is why you've been so successful in controlling the pandemic. I mean, I think I've read that it's meant that there's been sufficient hospital beds, so people particularly at risk from the virus, such as the elderly and those with underlying conditions, have been able to be hospitalized immediately.
The government coordinated with public health centers across the country to test potential patients on a large scale. The universal healthcare system enabled quick and easy access to patients' records to determine proper treatment.
해외 여행력 정보는 DUR, ITS, 건강보험 자격조회 시스템 등을 통해서 의료기관에 제공하여 선별 진료 등을 참조할 수 있도록 명단을 통보할 계획입니다.
South Korean health authorities are also leading a global research collaboration to share clinical data of COVID-19 patients. South Korea's healthcare system has proven its effectiveness in tackling an infectious disease from testing to treatment.
The gist of the country's so-called K-quarantine model is based on early testing, early tracing, and early treating. And all Koreans have access to this medical framework at a very affordable cost owing to Korea's national health insurance. For more on this, I have Kim Sun-min, the head of the Health Insurance Review and Assessment Service. Welcome to the program, Dr. Kim. Now, Dr. Kim, just for the sake of our viewers, let's start with a few words on the role of your agency and how it works with other relevant entities like the Central Disaster and Safety Countermeasure Headquarters in responding, that is, to crises like COVID-19.
Thank you very much for inviting me to this valuable program. As you introduced, I'm Sun-min Kim, the President of Health Insurance Review and Assessment Service, so-called HIRA. Actually, HIRA is one of the biggest two pillars to operate national health insurance in Korea. HIRA has main three functions within the umbrella of national health insurance system. The first is the setting the scope and standards of the services which are covered by the national health insurance. The second is to evaluate the cost and quality of health services. And the third one is to monitor and manage the healthcare resources, such as drugs, workforces, and facilities, and etc. For us to do this work, enormous range of the national level health data and information is critically important. It is very useful not only for the national health insurance but also for the entire healthcare delivery systems. It was proved and shown while Korean society responded to the COVID-19. Though HERA is not the front line, the worker for disease control, we have supported the government and the CDC in collecting, linking, and utilizing the information to early detect, prevent the spread and treat the confirmed cases of the COVID-19. For example, we receive the travel information of all the peoples and send the information to the health professionals in a very real-time basis to early detect the COVID-19 patient.
Dr. Kim, how much would a COVID-19 patient pay for his or her treatment here in Korea?
I think it is very thanks to the national health insurance. All the Korean people are enrolled in the national health insurance system. That means within this national health insurance system, the patients pay less than 20% of the total health costs themselves, especially for the essential cases. But especially for the COVID-19, even the out-of-pocket payments are covered by the local and central government. As a result, the COVID-19 patients with symptoms pay nothing to the hospitals when they use the healthcare services.
I see, so it's virtually free then. It's
Yeah,
actually free. I
yeah.
see. Now I also have here in the studio our Jason Strotherwa, a freelance journalist for PRI's The World. Hello Jason,
Nice to
good
be
to see you
back.
again.
Good to see you.
Jason, just for the sake of comparison then,
Sure.
how much would the treatment of a COVID-19 patient cost elsewhere around the world?
Well, of course, it depends on the health infrastructure of every country. Of course, many European nations have a similar system as South Korea does. But if we look at a country like Brazil, which is quickly emerging as another COVID-19 hotspot, about 80% of people are enrolled in a national health insurance system. But from what I understand, the healthcare infrastructure in Brazil has been depleted over the years, especially under current President Bolsonaro. So, a lot of charities and other donations are going right now to help the poorest of the poor who've contracted the coronavirus. Now, in the United States is a different story. There is no national health insurance system. Many people rely on private insurers. But a funny thing is in the United States, if you don't have insurance and you contract the new coronavirus, it's all pretty much covered by Uncle Sam, by the US government. However, if you have a private insurer through your employment, through the company you work for, you might be on the hook for paying, a few $1,000s. So in some cases now during this pandemic, it might actually be more financially beneficial if you have no health insurance and catch the coronavirus than if you actually have insurance.
That is interesting to know. Jason, feel free to ask Dr. Kim any questions that you might have about the health
sure.
program here.
There's so much that I've been covering here in Korea. I think my editors want to know, what can America do to emulate South Korea? And maybe that's the having the great health insurance system. That's something I enroll in Korea's national health insurance. But also the contact tracing, the ability of the government to find people who might have been exposed. So what I'm interested in, Dr. Kim, is how does your agency keep track of people's medical records that may have contracted COVID-19?
As I mentioned earlier, the HERA's main role is evaluating the quality and cost of the services which are covered by the national health insurance. It is possible because HERA's information system is totally connected with all the healthcare facilities and pharmaceutical stores across the country. It is very similar to the neural network of the human beings. The original purpose of the network was the claims review and the reimbursement and quality control, but we have widened the use of this system step by step over the last several decades. Thanks to these advanced nationwide information and communication systems, we were able to detect high-risk groups and stabilize the facial protective masks supply and build the national COVID-19 patient registry. Actually, our computerized information system is directly connected to all the healthcare professionals. Can you imagine?
I see, it's a wide network then.
Yeah. As I mentioned, we have built, as an example, we have built the national level drug utilization review system, which means within that system, we can real-timely monitor the drug use of all the patients in a real-time basis. When the doctors prescribe their drugs or the pharmaceutical stores dispense the drugs to the patients. So we can build the real-time mask the protective mask supply system thanks to this advanced neural network information systems.
So not only is it comprehensive, it's also really convenient then.
Convenient, yes. Yes.
Jason, again, just for the sake of comparison, is there a similar health care system elsewhere around the world?
Well, I mean, again, if we look at other countries, I mean, the UK has a very good healthcare system and insurance system, universal healthcare. Canada, but again, I gotta bring it back home. In the United States, this is something that we don't have, and no matter how many politicians, and we had Barack Obama try to pass the Affordable Care Act, to only have been eroded during the administration of President Trump, it would just cost maybe thousands of Americans the ability to have affordable health insurance. So unfortunately, it's just not every country can emulate what Korea has.
I see. Stepping away from the health insurance for a while, let's take a look at the medical infrastructure in countries around the world then. We've heard about cases of the infrastructure being weak in some countries. Is this a real reality, for example, in the US? We had medical experts, doctors and nurses who talked about shortages in supplies.
Sure. I mean, it's been kind of shocking, let's say. Some of the images I've seen, some of the stories I've heard from back in the United States of people, waiting in long lines outside of hospitals or at drive-in testing centers, waiting for hours in their cars to get tested. To people who are, really sick, who probably contracted the coronavirus. I've heard from people back home in the U.S. that we're clearly sick with symptoms, but we're told we can't take you into the hospital right now. We don't have the resources to treat you, and just wish for the best and hope you recover. So it's revealed a lot of holes in the American system. And again, to bring it back here to Korea, I think the network of specialized COVID-19 testing centers was something that has helped the country mitigate the spread of the coronavirus. And Dr. Kim, if I can ask you another question,
yeah.
I'd like to find out more about the oversight that the government has over some of these specialized facilities. How do you monitor what goes on at these special testing centers? Treatment centers?
Actually, by the law of the National Health Insurance, basically we have monitor and manage all the services which are provided by the healthcare service within the umbrella of National Health Insurance System. But after the very, very painful experiences of MERS in 2015, we have enacted new the infectious diseases law. Within the law, we have a special oversight function for the infectious diseases. Actually, we are depending on very private dominant healthcare providers, but the government have some kind of control power to the private sectors. They can designate the infectious diseases treatment treatment hospitals, and they can provide some kind of payment to encourage the hospitals to see the patients. And also, it is totally possible, thanks to the far advanced information and communication systems. It is not achieved within very short time. We have very long histories. And also, I'd like to stress the importance of the national health insurance system. We have more than 40-year history. It's a kind of the struggling history within our societies to enhance the coverage and the population of this kind of universal health coverage. It's a very long history of fighting.
Staying with that, Dr. Kim, you mentioned MERS of 2015. In quite a few cases, we have people comparing COVID-19 to MERS of 2015, and of course, SARS much earlier than that. Has there been any tangible change in the role of the national health insurance system back then and now?
Yeah. Actually, reflecting the year of MERS, it was very crazy situations. When we first faced with the MERS, the Korean government also felt very difficult situation. The decision making was not so fast, and the organization was not so easy. But thanks to this painful information, we have three changes. First, we have a kind of manuals and kind of the rules to only introduce the diagnostic test and the new pharmaceutical drugs for the COVID-19 or the newly emerging the infectious disease within the national health insurance benefit packages. So actually, we took about 2 days to introduce new diagnostic test. And also, we have realigned the information system in order for us to only introduce the collect and link and the use of the current data system, not only for the health information, but also all kind of information, including the mask supply and the travel information, and etc. It was the main 2 changes.
Jason, given the attention right now in Korea's strategy against COVID-19, do you see Korea's national health insurance system also receiving quite a bit of attention from those overseas?
Well, again, it comes down to what countries. I'm sure many countries that lack the type of insurance policies and programs that Korea does. I'm sure there are some envious eyes on Korea's system. But, the health insurance system, the healthcare system in many other developed countries is on par with Korea, let's say. But certainly, there's no doubt that, one of the first things I covered here when the pandemic began earlier this year was how, thanks in part to Korea's healthcare system, some of the worst effects of the disease had been mitigated. So I'm sure this is well aware to many other onlookers.
Right. Dr. Kim, how is your agency preparing for a post-COVID-19 period?
Yeah, I think we have a kind of plans and some to change our systems. The first is we have to realign the information system in order for us to more efficiently respond to the newly emerging diseases. Of course, we have developed those kind of systems, but I don't think it's enough. In order for us to respond to the other kind of disaster, including the newly emerging infectious diseases, we have to more comprehensively collect and link and use the data. The second is the benefit package management system. Even though we have adapted very efficient and very regular basis benefit package rearrangement system, but in order for us to respond to the newly emerging diseases, we have to realign those kind of benefit packagement decision-making system.
I see. All right, Dr. Kim, thank you very much for your thoughts today. And
Thank you.
Jason, as always, thank you for being with us.
Thank you.
Thank you very much.
Learned a lot from you.
And that brings us to the end of this week's edition of COVID-19. We'll be back with more on the global pandemic next week. In the meantime, do reach out to us through our social media accounts or our homepage, arirang.com. Do take care and have a safe weekend.